On August 27th, Sweden's public health agency claimed that 2 Swedish laboratories found defects in COVID-19 test kits imported from China. And that led to about 3,700 people in Sweden receiving false positive tests. Soon, several media outlets took this as an opportunity to question the effectiveness of Chinese test kits.
Sweden's public health agency announced that more than
3,700 residentes sa Sweden
are now returning made-in-China testing kits.
But did the Chinese test kits really fail to detect new COVID-19 cases? Lars Engstrand is the professor in charge of one of the labs mentioned in the article.
This test has been used in many countries, and in our hands today it works perfectly fine. I'm not worried today. The test kit works fine today, and we can validate with other kits and other labs, and we have 100% agreement between the answers.
Then why did the article say that the test kits were defective?
This test is very sensitive, and this means that you want to catch all the positive cases in the population, for example in Stockholm, when you have many cases, and this kit is very good. It will not miss any positive cases. This means that you can rely on the results, but you also have a chance to get what we call false positive. But when the situation changes and you have a very low number of infected individuals in the society, as we have now, then you can lower the sensitivity and be sure that you pick up the right positive cases. So you have not so many false positive cases. No test is 100% specific or sensitive. That means every test has this kind of balance, and you have to find out where this balance should be, and this is what we have done now in Sweden.
Any test requires a trade-off between sensitivity and specificity according to the needs of the time. In the coronavirus outbreak, blocking the virus transmission chain is the priority. The Chinese test kit may get the so-called false positive result, but it won't miss the infected people in need of isolation and treatment. And as the situation changes, the balance of specificity and sensitivity can be adjusted to adapt to different stages of the outbreak.